Thank you for your time, everyone. Today, I will be going to present a work that we did for our project system strengthening for better health activity, and it's basically for health emergency response component. This is one of the practice that we did, and it was called engaging community health worker, elected leaders, and other influential community members in communication and mobilizing activities to increase COVID-19 vaccine acceptance in municipalities with low vaccine coverage. The authors were Thaneswar Koirala, Sabitri Bhatta, Suresh Saha, Ajit Karna, and we were working in SSBS, which was a project of USA, and we were affiliated with Save the Children and APT Associate. And this was effort from all the staffs, but we have narrated it. That's why we have put our name as author. I'll go ahead. And after after COVID-19 pandemics all over the world, on 27th of January, government of Nepal have started vaccination campaigns. It was mainly based on priority basis. What that means is that the as the vaccines were vaccine available were not for every were not where we were not able to provide it to everyone. That's why a private priority groups were set up, like health workers were given at first, and then elderly. It was set up like that, and the vaccination campaigns or program were guided with NDVP, that is National Deployment and Vaccination Plan. Initially, the plan has um, like established for people over 15, but it was eventually 12 years old were also added, and then recently they have also added adolescent group and children above 5 years old. And then as a program, because system strengthening and better health program was working in the two provinces of Nepal, namely Karnali and Lumbini. And after the COVID pandemic, we were provided with more support from USAID for working with government to against COVID-19. And after first year, that is July 2022, July 2021, we have also started supporting in vaccination. The support whereas coordination, planning, and review, as we work very closely with and along with them, I would say. That's why we regularly coordinate with them. We plan and reviews. We do these in platforms such as steering committee meeting, coordination committee meeting, and in surveillance, we will support government in data information management, data flows, and if there is any problem with data, and surveillance process as well. And third is communication and community engagement. And fourth is like in communication engagement, we will basically work with preparing IEC materials or like having practices that will increase vaccination coverage in. And the practice that I will be sharing with you falls under this category only. And in vaccine administration and clinical management, we will support government in managing AEFI cases, that is adverse events following immunization. And we will also support in managing vaccine campaigns in this area, and for infection prevention, if they are facing any problems in regards to infection prevention, we will support them, like providing safety box and other supplies. And in vaccine logistics and cold chain management and transportation, we will support them mainly in cold chain management and transportation accordingly. Yeah, I'll go ahead. And for this, like our practice or our activity, we saw in first because the first year we have also supported vaccination campaigns, but it was limited, and that's why we have enrolled it in second year's plan. And during the first year, we found that people are hesitant to take COVID vaccine, like because we were getting many types of vaccine in our country, like Covishield, and from Verosil from China, and Covishield from India, and there were rumors starting. That's why they have doubts regarding quality, and like we have also heard about trust issues and fear of possible side effect, because there were two types of problem in Nepal. The people who are getting more information are like they have many information wrong, right, and the people who aren't getting any information. That's why it was imperative to do these type of activities that would target community. And for this activity, steps were in coordination with local government body that works in Information Communication Center, that is National Health Education Information Communication Center, and the Family Welfare Division, who is responsible providing vaccination in areas required, in Social Service Nursing Division, Vaccine Unit, and provincial governments for their inputs. We have prepared one concept note, then we have analyzed list for implementing, because it's a pilot project. We have like tried to look at data that have very no, and took municipalities that have very low vaccination coverage, and programmatic reviews were done with local representative, health worker, and social worker, and FCSBs. FCSBs are mainly female community health volunteers, that is equivalent with community health workers in and on other countries. Prepare one day orientation being the base of national risk communication and communication engagement, facilitate orientation in selected municipalities and documenting its outcomes, and like disseminating as well. And major expectations from the program was to understand impending vaccine acceptance factors, like uh, there was one assumption that they are hesitant or they aren't receiving knowledge, but we want to understand their like factors, their perspective regarding the vaccine coverage, increase vaccine acceptance and coverage among targeted age group, and home visit and interpersonal counseling by influential community members will help to dispel vaccine doubts and fear. We were trying to do, like, if influential community member will engage in these type of activities, they can influence the community that are difficult to make understand. That's why that was one of the target. Timely documentation and dissemination will facilitate analysis to determine the scalability of this intervention, because like we were trying to do it fast. Many stakeholders from government side and authorities were also trying to they were also like asking us for these type of support as well in for our from our program. That's why we are trying to do it faster and have one document that will say like this is working or this is not working, and ownership of tested orientation materials and method by federal and provincial government. Whatever we did or we were trying to do, we want government from federal side, provincial side, and local side to take ownership. And then the outcome or the process of programmatic review was we conducted meetings in 2 provinces, 42 events were done in 12 municipalities. The participants were elected local representative, health worker, community health volunteers, religious leaders, and influencer community members. Discussion on present scenario. The meeting goes like that. Goes went like discussions were presented on the scenario of municipality, factors that have contributed to low coverage. Mainly there it was open floor discussion that we said if we like the national scenario is this and the local scenario is this, and what are the things that are contributing in their thought, in their thinking, what are the things they think like is contributing to low coverage, and what for getting it done, what would be the strategies and future plans to increase the COVID-19 vaccination. And during programmatic review, we did have an action plan that would they have planned that it would increase vaccination in their area. And during programmatic review, some recommendations were made and which were according to our plan as well. Like they fell under our plan, like luckily I would say. And the recommendations were need mapping of community clusters and undertake home visits by FCSB and generate referrals. Even in a ward or municipality, they have cluster of areas where the vaccine was low, and it was also one of the learning that even we think like everywhere it will be same, but there also they have clusters, and uh, they said they need to map those areas and need to another way is to accelerate a school health program that will include school students, teachers, parents, and this will help in disseminating information much faster, and need to supply vaccine and related logistics as per need on time, like because there was scarcity during this review, and they said that we will be able to increase the vaccination if we were provided with vaccine on time, and need to inform vaccination dates and venue at least 1 week prior to the community people, because it was the for COVID vaccination. It was the campaigns were done so fast that no one can like really information on time. Sometime it has caused problem. That's why they have said that we will plan it accordingly and expand strengthen more communication intervention using multiple tools, use of social media and other multiple means of communication for targeted communication. That's in areas where it was easier to use social media. They said they will try to use it more, and there are areas where with low vaccination coverage that didn't have internet coverage, they didn't have radio or FM coverage. That's why they have started doing something like they will start miking and assigning a person to communicate these things as well. And then as there was one recommendation that we need to mobilize FCSBs for mapping, and we thought that it would be very good opportunity for orienting them regarding the vaccine, because during the meetings we also got that there are many misinformation conveyed to them as well. That's why one day orientation to community FCSBs and community leaders was planned. It was conducted in 2 provinces, in 12 municipalities, and in 45 batches. The process was one day orientation was package was prepared, and it was based on RCCE strategy, that is risk communication and community engagement strategy of NHIECC. And then one-day orientation in selected municipalities were conducted, and follow-up was followed up, and evaluation was done by this is health coordinators. They are chief of health section of municipality, and staff based on the action plan that was made during programmatic review. And then we document practices, learning successes, and it was also disseminated with the provincial government, NHICC, federal government, and other partners during coordination meeting in accordingly. Yeah, and the changes that we saw during the after our intervention was the baseline during November was this, and as of 28th of February 2022, it was this. You can see it in the table, and the total difference in increase was 39.11. That is considerable increase, and so that we came to conclusion that this works. And then the major learning were events acted as linkage between health worker and community leaders. There are very less platform that does this, like that brings together health worker and community leader at a time. And we can also be that has enabled us to do what are the things that community leaders or community people wants to say to health worker, and it has acted as that platform as well. And then capacity building, support in resolving myths regarding COVID-19 vaccination by general, like capacity building. And we were very much focused to health workers, and disseminating information regarding vaccination in social medias. But the community was out of the information, because during the meeting we came to know that even after around 6 months of vaccination, people were still confused about who are the people who can get vaccine. And that's why we thought that this was very important learning as well. And demographic event impacting vaccination, and because in the areas where we have low vaccination, we found it was consistent statement that the participants were saying that there is a seasonal migration for work, in India or in other countries. They will go to work and they will come back on certain time period. That's why we were unable, because we don't know the seasons where they will migrate. That's why we were unable to catch that population. That was another learning from this experience. And in communication gaps, that's what I have already said, that regarding types of vaccine available, eligibility for COVID-19 vaccination, and lack of IC materials. Not everywhere we have lots of information in areas where we could get, but in rural or Nepal, it was very difficult to get those. That's what we came to know during our intervention. And I think that's all from my side. Thank you. I will take questions after this.